Patricia styles. Yeah. Here is the case notes, Patricia styles. Right. Okay. So we are going to write number of letters. Sharla, you can also submit one letter. Okay. You can also submit one letter. Right. Okay. Right. So we are moving to the letter. Patricia styles is here. Emergency department consultant on duty. So consultant on duty, emergency department, Newtown Hospital, 100 Main Street, Newtown. So let us start correcting the letter. So consultant on duty, awesome handwriting. I like it. I really like it. I'm very much pleased to correct your letter. Emergency department. The flow is going just like that. Newtown Hospital, 100 Main Street, Newtown. Maintain the same handwriting, but improve if possible. It's very fine. 30 August 2019. Awesome, wonderful. Then next one, dear consultant. So here you can say consultant on duty. So you can say dear doctor. Dear doctor. Instead of saying dear consultant, it's better to say dear doctor. That will be fine. That would be fine. So if you say dear doctor, it would be even finer. Okay. Dear doctor, like this. Dear doctor. If you say, it would be finer. So that's good. So better to write dear doctor. Better to write dear doctor. Dear doctor. Dear doctor. Dear doctor. Then next. Dear doctor. That's better. Regarding Miss Patricia Styles, comma, date of birth, 27 April 1957. Awesome. Awesome is not the word. Absolutely fine. I really appreciate you. I had one student, his name, I think he only referred you. His name is, he's also from Lesotho. Because of him, many students joined. I don't remember her name, not his name, her name. I don't remember exactly her name. But I think after that, I see you, right? Really very, very obedient, following the system, very excellent, whatever I'm telling you. Okay, you're listening. Last one letter I corrected, and now this letter. Awesome. Okay, but still you have to improve. It's not final. You have to improve still, but still it's better, far better than the previous attempt. Miss Styles, very good. Who is having signs and symptoms? Don't say who is having signs and symptoms. Say who has. Means it's just not just now. Yesterday also he had, today also he will have, tomorrow also he will have, maybe for quite some time he will have. So make it as a present simple. Is having means present continuous, means only now. That means 1 minute before he did not have, afterwards he did not have. For example, I have $1,000 now. That means 1 day before maybe I don't have, 1 day, next day I will not have. We don't know, we are not guaranteed. So that is means present only you're talking. I have now, that's all. That means you're not talking about previous. 1 hour before, 1 day before, you're not talking. 1 hour later, 1 day later, you're not talking. So present simple means in general. Who has? Yesterday he had, today he has, tomorrow also will have, like that. In general sense. Is having means restricted only till now. As of now, that is the meaning. So it's better to say who has. Okay, this is not just now. So, okay, who has now. It's not just now. Okay, who has signs and symptoms. Okay, suggestive of, not of suggestive. Okay, suggestive of, okay, suggestive of relapse or complications of pericarditis, comma, put a comma here, correct your paper, huh? I cannot put everywhere everything, so you can put it in your paper, comma, okay, comma, okay, okay, requires urgent examination and appropriate care at your facility today. Okay. Right. Urgent hospital transfer to Newtown Hospital. Okay. This is a home visit. This is a home visit. Requires urgent examination. What is here? Urgent is here. Emergency is here. So you said referral here. Okay. So here referral, this is a letter, referral letter. So don't write requires. If it is a referral letter, don't say requires. Then you say is being referred. Is being referred for. So write like this. Is being referred for urgent examination. Urgent examination. And appropriate care. Not care, appropriate management. Not just care, you have to manage condition also. So better to say appropriate management. Appropriate management at your facility following the transfer to your facility today. Following the transfer to your facility today. Okay. So following the transfer, you're transferring the patient here. Okay. You're transferring through ambulance. Okay. Following the transfer. So you're arranging all these things. Organize urgent hospital transfer to Newtown Hospital. So you are urgent this. You're sending it. And it is following the transfer. See here. This is a referral letter, but still you are transferring the patient there. Okay. So appropriate management at your facility today. Right. Urgent means not even today, now. Immediately, that's it. Urgent, no need of today also. Fine, that's okay. That's even if it is there also, it's okay. During a home visit, not a home visit, during today's home visit. During today's home visit. Very good. This is an urgent letter. So you brought today's visit first. During today's home visit. So during a home visit today. So during today's home visit, or during not a home visit, during the home visit, only one home visit you made today. So during the home visit, you say. If you say during today's home visit, one word is also saved. So during today's home visit, that is also correct, but you have to say the here. During the home visit today, okay. Chest pain, chest pain, shortness of breath, and a lethargy were reported absolutely fine. You did not repeat here, Miss Styles. Very good. I liked it. Awesome. If you go on writing like this, you'll get B+, not B. People are dying for, people are crying for, people are lamenting for, people are suffering for B grade. You will get B+ if you write like this. quality is this. Okay. One report. Very good. Anxiety concerning sluggish recovery was voiced out. Very good. As it has led to sadness. Okay. So it's not only sadness, it's also anxiety. Okay, tension, worry, everything. Okay, fine. That's okay. That's good. Anxiety concerning sluggish recovery was voiced out as it has led to sadness, leading to sadness at his, okay, sluggish recovery, leading to sadness as it has led to sadness. You can remove all these things. As it has led to sadness, remove everything. Recovery leading to sadness was voiced out. Like that also you can say. This is also correct. There is no wrong in this one. There is no wrong in this one. But only the problem is you are using the word it. That is a personal pronoun. It is a personal pronoun. So this avoid personal pronouns as far as possible. It has led to sadness. Okay. Active voice also is there. So try to avoid active voice. Try to avoid personal pronouns. Medication and blood glucose monitoring were being othered too. Medication and blood glucose monitoring were being adhered to. Excellent. I have never seen student writing like this. Really, I'm telling you, this is a different style. Okay. It's a different style, little difficult, but you did perfectly well, no mistake. Medication and blood glucose monitoring were being adhered to. Okay. So it's a today's visit. So why do you want to write past tense? Are being othered, are being, or have been. So write present tense. What is past tense? This is today. So don't use past tense. Don't use past tense. We can say are being or have been. Or are being othered or have been othered to. Are being othered means continuation. Are being othered or have been othered, present perfect. Okay. Are being or have been. Both are fine. Both are fine, not were, but are being. Have been. Added to. Vital signs. Is it vital or vital? A is not very clear. Be careful. And you have to leave a space after full stop. And this O is not clear. Vital signs were being taken and all were elevated except the blood pressure. With the exception of blood pressure, all the vital signs were elevated. You can say were elevated only after taken. So why do you want to write vital signs were being taken? Were being taken means action is going on. Then how can you say they are elevated? Were taken, have been taken, have been taken. Present perfect tense. Were being taken means what? Continuous tense. So it's not finished. Are being, were being. Okay, means continuous tense. That means not completed. If the tests, the vital signs were not complete, taking the vital signs were not completed, how can you say that they are elevated? It is in the process. So say finished. Vital signs have been taken. Okay, are taken. So like that you can say. Not past tense. Don't use past tense. Present tense you use. With the exception of blood pressure, all the other vital signs have are elevated. Are elevated. So blood pressure, which was 125/78 mmHg. So with the exception of blood pressure at 125/78 mmHg, all the other vital signs are elevated. Finished. Next one. This is fine. This is also fine. Vital signs were being taken. Were taken, not being taken. Not past tense. Why past tense? We can say have been taken or are taken. Are taken. Are taken. Are is enough. Present perfect. Present simple. Passive. Present simple. I take. Are taken. Okay. So present passive. Or have been taken. Have been taken. That's best. Finished. Have been taken. This is better. All the vital signs have been taken and all are elevated. Or no past tense here because this is 2 days. Okay, otherwise you have say in the morning or 1 hour back, ago, like that, then past tense you can use. Otherwise you cannot use. Today means present tense you have to use. Or 1 hour ago, then past tense you can use. So here, are elevated. Right, very good. Your style is very good. You can definitely improve. Socially, Miss Tiles has been retired. Has been retired. Miss Tiles is retired. Is retired. No need has been. Not that somebody has forcefully made him retire. So has retired. Miss Tiles has retired as a primary school teacher and stays alone. Full stop. After full stop, you have to leave space. 1 to 2 glasses of wine are taken weekly. So here you can change the style. This is not very fine. Okay. You are not saying this. Okay. You can say regular weekly consumption, regular weekly alcohol consumption. See the quality of the sentence. Regular weekly alcohol consumption of 1 or 2 glasses of wine has been notified. See the quality. Okay, I know you can pick this quality. Makoko. Your name little confuses me. Okay. Linio Bohloko. Yeah, Linio Bohloko. Hello, Marenang. Hello. Unmute, please. Okay. You have a problem. Okay, don't unmute. Don't unmute. You can do it. You can do it. Okay. iPhone. There is somebody, iPhone. iPhone has come to learn. Can you please write your name? Yes. Okay. iPhone. Where is iPhone? What is this? Share screen. What is this? What's this happening? Who is the host now? How come host is shifted? Reclaim host. Yeah. Please share. Okay. Rename. First and second. I am naming you as first and second. I need your first and second names, please. Thank you very much for obliging. Okay. So, right. Notify. Medically. Don't write these things socially, medically. Why do you want to give these labels? People can understand that is the social history. People can understand that this is medical history. So why do you want people cannot understand? Am I crazy? I cannot understand what is medical related things and what is social related things. People write all things. No need. Those who don't understand, they need this one. For example, I am a man or a woman. If doesn't know, then I have to put a label. I am a woman or a man like that one. Or if somebody knows I am a teacher, no need anything. They can understand that I am a teacher. If nobody knows, then I should write here teacher label. So labels are those. Labels should be there for those people who don't understand. Here all are professionals, so everyone can understand. So don't label it like socially, medically, and all these things. Okay? Don't label, please, not necessary. This is for those people who lack knowledge. Those who don't have understanding. They don't understand. For example, this is a hall. Looking at this one, everyone can understand hall. So no need to put hall here. And no need to put bedroom. No need to put kitchen. Because you already know everything there. You can understand. For some people, if the doors are closed and they will not be open, then for the people to know, because people don't know, the labels will be there. Otherwise, no need labels. So remember that. Labels are those for those people who don't know. Here all are medical professionals. No need to label all these things. Okay. Now, hypertension has been diagnosed. Oh my God, what you are talking? Has been diagnosed. How long it is been diagnosed? Diagnosis is 1 minute, 1 second finished. Yeah, okay, you have hypertension. Finished. How can it be has been diagnosed, and that too since 2011? Hypertension was diagnosed in 2011. Or you can say he has had hypertension since 2011. Having hypertension is going on continuing, but a diagnosis will not be continued for so long time. Diagnosis is a one-time action, and the medical condition is a long-time condition. So let me give you the point here. Okay. Hypertension was diagnosed. Whenever you say diagnosed, you say simple past. In 2011. This is the sentence. Or if you say he has this condition, then you say he has had hypertension since 2011. Or you can also say he has had hypertension for the last 11 years. This is duration. That is starting time, point of time. This is period of time. Now from 2011 till 2020 to 11 years. So for the period for the last 11 years or since 2011 means point of time. Okay. So you don't know this concept. So learn this concept. Learn this concept. So who is there for the next letter? Okay. Who is there for the next letter? Let me check it out. Next letter is, there is Tresia Rinsi. There is Nasra Muhammad. Is there Tresia Rinsi or Nasra Muhammad here? Tresia is not there. Nasra is not there. So anybody wants letter correction, you can tell me here. Okay. Yes. Anybody wants letters correction? Regular students only. Regular students who have registered. Okay. Who are registered? There is one Shahla, there is one Shifali, then there is one Laraib. Yeah, you can type your name here. Laraib, yeah, next to your letter. Okay, definitely. So I told you send your letter there. I asked you to send your letter here. So I'll correct your letter next. Where is Laraib? Yeah, Laraib Adil, you have already sent the letter here. I'll correct this one. Next is yours. Next, your turn. So be ready. Next, your turn. Yeah, you sent already on the Telegram. That's awesome. So this is the way you can write. The next one. Quinaprol has been started. Has been started. No, was started. Starting also will happen in 1 minute. Has been taken means taking a long time, but starting only once you start, it will go on, continue. Continuation will be prolonged, but starting only 1 minute. It's also like that only, like diagnosis. So simple past tense. Simple past tense. Was started, was commenced. Say commenced. Say not has been, it's was commenced. Better. Was commenced. That is also in 2013. Okay. Was commenced in 2013. Okay. For which he is on quinapril. Like that you can say. For which he is on quinapril. Quinapril is a brand name or generic name. Is quinapril is a brand or a generic name. So quinapril, acupril is a drug. Quinapril is a prescription drug. The brand or generic. What is the generic name of quinapril? So quinapril is, what is the generic name for quinapril? Okay, let us see. So it's all generic drug. Brand and generic, both then. Okay, then that is fine. Let us go to the case notes. Quinapril. Quinapril. Yeah, quinapril is a generic name. Acupril is a brand name. So A capital letter, Q brand name, small letter. So why don't you write Acupril brand name? Means when there is a brand name, why are you taking a generic name? For example, your name is Marenang, and your another name is nurse, and your another name is a woman or lady. So now how should I call you? Because I already know you. If I don't know you, I will call you lady or woman or nurse. But if I know you by name, it's better to call you by name, Marenang. I'll not call you nurse. In the same way, generic name is not important here. Brand name is important. So write Acupril. Write the brand name. Acupril. Yeah. When brand name is there, use brand name, no, with capital letter. And you are making two mistakes here. One is you are using generic name. That is correct. If you write quinapril, metformin and glycoside, you will get 10 marks. These three names together you write, you will get 10 marks. But if you write Acupril, Diabex and APO glycoside MR, then you will get 20 marks because 10 plus 10, 20 marks. It's a double. If I call you nurse, you will not be happy. If your patients call you nurse, you will be happy. Sir, you know my name? No, sir. Then why are you calling me nurse? Why are you calling me lady? You can call me Marenang, no? So now you understand what it is. When you know the name of the medication, brand name, why are you calling it by an ordinary name when it has a special name and you know that there is a special name? People don't know. They think easy. You write quinapril, one drug, metformin, another drug, glycoside, another drug, 3 drugs you are writing. If you write all these 3 things, definitely you will get 10 marks. Because you are writing generic names. But generic names are, anybody can write generic names. But bracket means more important here. This is a brand name. Specifically Acupril. If you write Acupril, if you write Diabex, if you write APO glycoside MR, that these 3 brand names, if you write, that means you are not getting 10 marks, you are getting 20 marks. People are crazy. I don't know. They don't understand what is the importance of things. Okay. You don't be crazy. Okay. You be wise enough. You be wise enough. Okay. Wise. That is called wisdom. Earlier you were ignorant, you don't know. Ignorant means not wrong word. Earlier you were not wise, you did not have knowledge. Now you have knowledge. So use that knowledge and become wise. Don't use that knowledge, become foolish. That's all. There is no difference in that. Knowingly you don't do something, it is foolishness. Knowingly you do something which is good, that is wise, wisdom. So mind you, I'm not telling anything wrong. I'm telling the fact. Fact of the matter is that. So use this. Okay. These are very important names. Okay. See here. See here. Metformin is there. Vinopril, but brand name Acupril is also given. Metformin, Diabex name is also given. Gliclazide, APO gliclazide, MR is given. So you can write like this, you will get 10 marks. In that place, you write like this, you will get 20 marks. 3 points you are giving, so 3 points will get 10 marks. So already you are writing Vinopril, Metformin, and Gliclazide. You will get 10 marks. And you write Acupril, Diabex, and APO gliclazide MR. Remove the bracket. Remove gliclazide, remove Vinopril, remove Metformin. So write the brand names. You will get 20 marks. If I call you nurse, you will give me 10 marks. If I call you Marenang, you will give 20 marks. You will be very happy. Sir, you are not my patient. How can you call me nurse? You are my teacher. You should know my name. I'm not a nurse for you. I'm a student for you. You should know me by name. So that is the difference. Now you understand what I'm telling you. So special name is there. So use special name. Nurse is a common name or lady is a common name. If I call you a student or member or student or subscriber, then you will be upset. Sir, don't you know my name? Why are you calling student? How can I call you student? I'm calling you by the name Marenang. Why? I can call you student. I can call you lady. I can call you nurse. I can anything, but I don't call you. I'm calling you Marenang. Why? Because Marenang is special. Here also APO gliclazide MR is special. So use that one. All are doing this mistake. So I'm explaining this. So nobody wants to come and attend these sessions of others when I'm correcting. They want to get their letters corrected. Again, they'll do these mistakes. But if you listen to these lectures, others also will get benefit. Nah? So before doing a mistake, you will learn from here. Why do you want to do a mistake and come to me again? As the blood pressure has been reported to have been elevated. Okay. Elevated blood pressure has been reported. Finish. Elevated. See here, elevated blood pressure has been reported. That's all. Why so long, this much? Elevated blood pressure has been reported. That's all. Why all these things beating around the bush? As the blood pressure has been reported to have been elevated. Why beating around the bush? Elevated blood pressure has been reported. Finished? Okay. Elevated blood pressure has been reported. Okay. Now here, when it was long back, you need not say has been. It was diagnosed, was commenced, was reported. This is history, past, 2001 and 2003. Now we are 2022. So was reported. Here it is was diagnosed, not has been diagnosed, was diagnosed, was commenced. Has been is for present tense. You don't know what is present tense, what is, you are saying 2011. That means you are measuring in years. So 2023 So 2022 is present tense. Even 2021 is also past tense. Then why are you writing present tense? 2022 on you're taking year 2021. That means you're calculating time according to years. So this year means 2022. Okay, the year you are writing this letter, 2019. So 2019 is present. 2018 is past. 2020 is future. Because we are based on years only you are dividing. You can understand that one. And adhired, spelling A-D-H, not T-H. I thought spelling mistakes are not there. You already are writing spelling mistakes. Adhired. Adherence to medication, compliance, adherence to, okay, monitoring not only medication but also blood glucose. Okay, adherence to monitoring not only medication but also blood glucose has been noticed. Like that also you can say. So spelling mistake, write 10 times. And I want to see if you don't write this 10 times and send me, I will not correct your next letter. Okay. Signs have been taken. Okay, this is done. Okay, diabetes mellitus type 2 has been confirmed. Was confirmed. 2013, again it's past. So how can you say has been present tense? 2013 is past because 2019 is present. If it is 2019, you can say has been. Was confirmed. And hypoglycemics, namely metformin and glycoside, have been administered. Were administered, not have been. Because it is past tense. Or for which he is on. You can say now also he is on. Were administered. Weight loss, space. Lifestyle modification. Don't say changes. Weight loss. Not weight loss, weight reduction. Right? Quality words, no? Weight reduction. Comma. Lifestyle modifications. Lifestyle modifications. And nutritious. 1 minute, let me confirm. I'm also getting doubts now. What to do? Nutritious. Yeah, correct only. My spelling is correct only. I'm getting doubt. Crazy. Nutritious. Nutritious dietary regimen have been recommended. Weight reduction, lifestyle modifications, and nutritious dietary regimen have been recommended. Okay. Depression has been triggered. Another spelling mistake. Triggered. E-R-E-D. T-R-I-G-G-E-R-E-D. Triggered. That is the spelling. Triggered is informal word. Triggered is informal word. So avoiding such informal word is better. It's informal word. It's not formal. Trigger. Means start. Yeah, trigger you can use. Yeah, to cause something to start, you can use. Triggered, showing, but here it's okay. Triggered, spelling. Triggered. Depression has been triggered by the passing away of the husband. Depression following the death or demise of husband, okay, has been noticed. You can say like that. Depression has been triggered. Depression was triggered. Past tense. Starting, no? So was. Husband passed away in 2006. So past tense. 2006. 2019 means present tense. 2016 means past tense. You are writing and showing that it is 2006. And how can you write present perfect tense? It is like yesterday, I have played cricket. No, yesterday I played cricket. Today, I have played cricket. Yesterday, I played cricket. Simple past. And constant counseling sessions have been conducted. Based on the aforementioned circumstances, immediate admission, assessment, and proper management would be profoundly beneficial. Spelling CIAL. CIAL, not TIAL. CIAL. Third spelling mistake. So 3 spelling mistakes. That means you lost 10 marks. Beneficial. Beneficial. That means you have to write these 3 words 10 times and send it to me. Beneficial. Next time in your exam, in your next papers, I don't want this mistakes. Same mistakes. You do different mistakes. In case any additional information is required, please do not hesitate to contact me. Is better. Write a little big now. Please do not hesitate to contact me. Please do not hesitate. In case any additional information is required, please do not hesitate to contact me. Yeah. Yours faithfully, consultant on duty. So yours faithful name we don't know. So yours faithfully. Okay. Okay. You are a nurse. Okay. Yes. That's enough. No need to write home visit. Nurse is enough. Because you wrote home visit there. No need home visit. Okay, just write nurse. That is enough. Yeah. Okay, Preeti Prakash, go for your duty. Thank you for attending the session. So what you can do is Marenang Makoko. Marenang Makoko, what you have to do is you have to write these 3 words which you have made spelling mistakes 10 times each. Okay. And try to learn these things. Okay. And then in the next letter, use the same style. So give your feedback there. Give your feedback there, Marenang Makoko. Give your feedback there. So that's it. Stop live screen. Hello and welcome to Seven Sentinels. This is Grand Master Class and I am Peter Simon with you. Yes, you have seen our writing corrections. If you're interested in attending these sessions, subscribe to our YouTube channel, like and share the link, and press the buzzer icon, bell icon for updating yourself with the regular sessions ongoing on YouTube, so that you'll be the first to watch the programs when they are live, because most of our sessions will be live sessions only rather than recorded sessions. So you can watch live, first-hand experience. And now, because Christmas is coming at the horizon, so we are celebrating Christmas with you. So Christmas celebrations, Grandmaster class is offering special, sales or special offers or scholarships. If anybody is interested for writing corrections or subscriptions individually, or speaking practice individually with proper feedback. And to tell you first thing, we are not nurses and doctors who have just passed OET and are coming and teaching something. We are professionally qualified, academically certified, and internationally recognized certificate holders. So you can understand the difference. We are not a nurse by profession, we are teachers by profession. And to be more specific, we are teachers trainers. So we'll provide you the best if anybody is interested, but beware. First thing, if you're only serious, approach us. Otherwise, take your decision wisely. If you're really, really, really dedicated and serious, you approach us. So you can contact the coordinator, Ashwini Sunita. She's the OET preparation project coordinator for Grandmaster class. So she will discuss with you and she will get back to me if any requirement is there. And you can download the application and you can get back to us. We are giving away, okay, right? We are throwing a party on this Christmas. You can enjoy the feast. Contact the number given here, because I'll be busy mostly. So she will guide you and help you.